David Dollar, a well-known sort of writer on effectiveness, has a great line about the effectiveness of aid. He calls it, aid is very effective, ineffective, and everything in between. And in fact, aid can be counterproductive as not well targeted. I think we can be a little bit more positive than this, but we can't underestimate the challenges of assessing effectiveness. I mean, beyond the reporting of outputs such as roads built, schools constructed, important though that is, outcomes such as improving literacy and reducing poverty and the other MDGs that Minar pointed out depend on a range of factors, not least domestic policies and actions, external factors such as global economic conditions, and the role of development actors. It also takes time for such impacts to materialise, and it's often beyond the life of aid interventions. So there's a real challenge in trying to assess in real time the effectiveness of aid. And further, there's the question, and there's also the response we usually say when we can't answer the question properly is, it would have been worse if we weren't there. And I think, though, there's a real sort of need for us to really think about how we can do the counterfactual analysis more than we currently are. There's more work being done. There's a big international initiative on rigorous impact evaluations to fill that knowledge gap, but it's a difficult and embryonic bit of work, but I think quite important. So how do we assess effectiveness? And I think basically we do it at three levels. One is at the basic aid activity level, the second is at the country or sector level, and the third is at the aid delivery level and the process level. And we're just pretty much picking up on the stuff that Minar was talking about, is are we implementing our aid program consistent with international best practice, such as codified in the Paris Declaration and more recently with the Accra Agenda of Action. At the activity level, that's our bread and butter. It's our real sort of the engine room of our reporting, has been for many years, and it's improved recently quite substantially. And what we can actually say is that 85% of our activities will achieve their objectives. And these findings are backed up by independent assessments. They're delivering a wide range of results from better budgeting to improved service delivery. And there's a stream of these sort of achievements and examples, such as 760,000 people in Vietnam with access to safe water, over 500,000 with improved sanitation with just one program alone. There's 2,000 schools being constructed in Indonesia, and hundreds of thousands of kids have been immunised in the Philippines and PNG. I mean, as I said, there's a long list. But it's interesting, what we're finding is that we're much more confident of our results in the technical sectors such as economic governance infrastructure than in the more difficult service delivery areas. And I think this reflects the experience of other donors, and if I had more time, I could expand on that a bit. But while all these are likely to achieve their objectives, most have scope for improvement. And interestingly, all our activity managers think that where that scope to improvement lies is in the sustainability of benefits past the end of a project life. And I think this picks up on a lot of the things that will come up in the discussion with Juliet and Ronald. But beyond accounting for all the good things that we've done, we're also interested in understanding how our suite of aid activities, our policy dialogue with government, and our partnerships with other development actors are contributing to lasting and improved development outcomes. And in this respect, we also look at performance at the country and sector level, and really trying to understand whether our country and sectoral level objectives are being achieved. Essentially, we're doing all these things to achieve an end, and we want to know whether that end's actually being achieved beyond whether we've actually delivered our aid activities satisfactorily. And here it is much more difficult to tell. I mean, as discussed previously, there's more influences at play when trying to assess effectiveness at that level. So methodologically, it's very difficult to determine the impact of Australian aid over a high-level outcome. For instance, a project that might build health clinics and trade midwives might do that very well, but it'll take a long time before maternal infant mortality rates may decline. And what might be stopping better health outcomes might in fact be something completely different to what we're doing. For instance, inadequate pay for nurses, poor public financial management stopping the flow of funds going to health clinics, the lack of security. And we've seen this in many of our own programs that we've done. And to this end, over the last 2 or 3 years, I mean, AusAid has invested significant effort in trying to understand the outcomes at that broader country and sectoral level. And while it's early days, we are finding that we are less confident of achieving these higher level strategy level objectives than we are at the activity level. And I guess that's not surprising given the range of external factors at play. Our own program managers think that 60% of our strategy objectives are assessed as they'll be only partially achieved. So they're not confident they're going to fully achieve their strategy level objectives. And so emerging findings suggest that a couple of things. One, and this will probably come back again in various ways later on, is that the level of ownership and commitment by a country government, a partner country, is absolutely critical to achieving outcomes. But such ownership is not static, and it's often not deep. And it brings to the importance of this broader issue of broader societal ownership beyond central governments, and also how we engage in policy dialogue. The second area is that we seem to have an issue around matching assistance to the context, and it's what we're seeing is how and what aid is provided is actually important in actually achieving the outcomes at big level. And we've had quite a notable success in the Solomon Islands during the financial crisis, where we basically funded the continuation of the health service. We don't usually do that, just a straight funding of health service in the absence of other sort of assistance. And that's now credited as being actually absolutely essential in actually stopping the whole Solomon Islands public health system collapsing, as it had done in similar situations in other parts of the world. So there's some emerging findings that sort of pointing to a number of things from our own experience and sort of backing up the directions that are coming out of the Paris Declaration in some of those sort of issues around ownership, around about aligning and harmonisation, which I think we might be touching on later. And as I said, the third level is that we look at assessment is at the aid delivery level. As I said, this is incorporating most of our activity in country level assessments. We also try to monitor these on a broader level. And this is the stuff out of the Paris Declaration, which we also know from decades of aid experience are more likely to achieve development outcomes than previous thing. And essentially what it's about is changing the nature of the relationships between donors and partner countries, and between donors, and between partner countries and their populations. And it's redefining those relationships. And they talk about it in terms of harmonisation, alignment and ownership. It's actually really about relationships and partnerships and a change in the power structure between those partnerships. And in essence, it's a move away from that standalone donor-driven projects to a system that's based more on countries' own plans and aligned with their systems and harmonised with our donors. And this sounds simple and bleedingly obvious to the average punter, but it's actually a real challenge in trying to implement that. There's issues around the capacity of the partner to actually build a sort of consensus and own a development process. There's issues around fiduciary and implementation risk of using government systems. And there's these issues around what do we mean by ownership. And all these things are factors that how fast and how quickly and how you actually try to move down this new way. Okay, so forward challenges. Quickly, very three. One, evidence base. That's a work in progress. We still need to build it. Secondly, we've got to get partners. The big issue is trying to get partners themselves to lead on the effectiveness agenda, not just for aid, but for their own. And the third one, which is the big elephant in the room, is the impact of the global financial crisis and what this means for aid programs. I was going to say a lot more about that, but I've got not enough time. And finally, I guess, to reiterate the fact that a dialogue on aid effectiveness does require a lot of political courage and public support. Development is a difficult business and it's easy to criticise, but we need to be open to learn from experience. So thank you.